Marijuana Management Symposium. Last year, we decided we were going to put this on because we had, we were first out of the gate with legalized marijuana, only by a couple of months, a little bit ahead of Washington. But we had so many questions, so many people were looking to us that we decided it would be most efficient and effective to get us all here together to answer all the questions at once. So here we are a year later, and we're still getting a lot of questions. And at the same time as we're getting questions, others of you have more fully implemented your legalized marijuana. Others of you have built out bigger and better frameworks. Others of you have marijuana legalization on the ballot. So we figured we had to do it again a second year so we could continue to learn from each other, to learn from you, and to understand that we are constantly evolving right now with marijuana being so new for all of us. There is an article that my office and I frequently refer back to, and it was by the RAND Drug Policy Institute. And the heading said something like, marijuana policy should not be frozen into its initial design. The quote goes on to say, there's no recipe for marijuana legalization, nor are there working models of established, fully legalized marijuana markets. It must be expected that any set of initial choices will need to be reconsidered in the light of experience, new knowledge, and changing conditions, including federal policy and the policies of neighboring states. So that's another reason why we're here. We are committed to continuing to learn, to monitor what we've done, to monitor our rules and regulations, to track what the outcomes are, and to change when necessary. We've got about 400 people from not just all over the country, but all over the world. And so then looking at that, we have international visitors. We have visitors from probably about, I think last count was about 16 or 17 states, including DC. We have multiple representatives from Colorado. We have multiple jurisdictions and cities and towns represented here today, and we welcome you all. Great. So then sort of the next question is, we have a whole bunch of people here from all over the country. The next question is, what do we do and who are we? Most of us are government officials and regulators. We have law enforcement represented, we have public health officials, we have environmental health officials, we have attorneys, we have firefighters, we have licensing authorities, we have treasurers, I saw some tax collectors, we have some other city council type people. We have a number of different people here from all walks of life in the government, but we also have non-government people here. We have some community representatives here. We have some advocates for legalization, and we have some proponents of legalization. And we also have industry themselves, some industry members represented here. And we welcome all voices to the table because, as you guys will see, for those of you who are already involved in this, and for those of you who will be involved in it soon, it has been very important to us to build our regulatory framework, having all those voices at the table so that as we're moving forward with our framework, we're able to balance the needs and desires of all of our community. So we are here today to share ideas about regulating, how to do it, hopefully develop some best practices, learn from each other. We're not here to debate whether legalization is good or bad, just that now that it's here, how do we do it? How are we rolling this out? So please take advantage of the group that we've assembled here today, because that's been one of the most important things for Denver, is the contacts that we have throughout the country and throughout the world to talk and call people and brainstorm about ideas. So with that, we will now move on to the first session, which is with Andrew and myself, entitled 3 Years In, What's Happened in the First 3 Years in Colorado. And I will sit down and introduce Andrew for you. All right, Andrew is a Colorado native, and he holds a bachelor's degree in philosophy and political science from Tufts University, and in 2010 earned his JD from Harvard Law School. Upon law school graduation, Andrew joined John Hickenlooper's campaign for governor and was tapped to serve as Lieutenant Governor Joe Garcia's chief of staff. During his time with Garcia, the Lieutenant Governor's office won a $45 million Race to the Top grant for early childhood education, created the Office of Early Childhood, helped pass the READ Act, collaborated with the Mile High United Way to create Colorado's Reading Corps. In 2013, Andrew left the governor's office to become the director of Colorado Commits to Kids, the Yes on 66 campaign, the largest effort to date to overhaul Colorado's education funding system. In 2014, Andrew was appointed to be the state's first director of marijuana coordination. As a director, Andrew's mission is to ensure the efficient and effective regulation of Colorado's retail and medical marijuana program while promoting public health, maintaining public safety, and keeping marijuana out of the hands of children.
Morning, everybody. First, just a round of applause for Ashley, Molly, Marley, and Dan. I think this is an amazing idea. I'm jealous that we didn't do it on the state level, but it's an unbelievable amount of work to get this done, and it is for the betterment of the world. So thank you, guys. You know, for those who might have been here last year and heard my speech last year, part of what we were debating is how much has changed, how different is this landscape from a year ago, and I will actually tell you it is a much different landscape, and this is moving so fast. I think the things that we were patting ourselves on the back for last year now look completely different this year, and one of the themes that is coming out is how truly complicated this gets over time, and that this isn't a light switch that suddenly you vote for legalized marijuana, maybe you put a hard 6 months work into it, and then you find yourself at the other end of this and it's stabilized. This will take continual action, and so I really do applaud people for coming up here. I know places like LA County, I've been talking to their office quite a bit, and the amount of proactive work that's going in trying to see around the corner is so much different than kind of the head in the sand moment that we were seeing 3 or 4 years ago. You would never see a room like this. You would never see any elected official show up, maybe a few, but not certainly to the extent that they are here now to try to figure this out. And I think that's a testament to understanding that good government is different than ideology. And so, again, I applaud everybody for thinking about this in a way that can best protect public health, public safety, regardless of how you think about marijuana legalization. For a brief history, a brief recap of how we got here. In 2000, we passed Amendment 20, that was medical marijuana. The state kind of didn't do anything with that it created this kind of loose caregiver system or patient system that you could grow your own marijuana. And starting in 2009, Denver and some entrepreneurs started to open up licensed retail facilities. The state of Colorado decided they had to get into the game a little bit and actually created a medical marijuana code. That's when we started to actually license medical marijuana, 2009, 2010. Voters decided they liked that so much that in 2012 they passed recreational marijuana, which specifically called for a retail system. And so we spent a full year with what was called the Amendment 64 Task Force, and that was everyone who wanted an opinion or who had an opinion on marijuana legalization, whether you're talking about industry members, proponents, opponents. We have a group of concerned mothers called Smart Colorado. We had our public health officials. We had people from Children's Hospital, everybody who wanted a voice in how this was going to look into the future came together and put together recommendations for the task for the starting report, which was the basis then for kind of the omnibus legislation that started recreational marijuana. And starting January 1st, 2014, the starting gun fired and we were off to the races. And so I know that was quick. I would say to anybody who's looking to do this, creating those collaborative groups that you can, again, reach into every time you come across a problem helps you figure out how to solve that problem. And there's this bit that if everybody understands why it is that you made the choices you made at the time, when the unintended consequences come up with those choices, it's not just finger pointing. People say, okay, we made this decision. It was a rational decision. It's led to this. And so let's go back and revisit why we made that decision. And so again, I would suggest having these conversations as much in the public's eye as possible and with everybody who wants to talk about it, everybody who wants to have an opinion. The minor miracle, and I think something that we still kind of pinch ourselves every day, is that the regulated system has ended up working more or less. We have now created an industry, or the industry's created itself. We have now put guardrails around an industry that does truly track every marijuana plant from seed to sale with radio frequency identifier tags, that does enter that data into the metric tracking software. I think if you talk to industry members, they might get a little annoyed with the system, but we work with them as much as possible to make sure that that system goes through. We do stings of 21 and or we do stings of trying to get minors to sell marijuana. There are very high compliance rates of all this different public health, public safety, youth prevention, sorts of things that you would expect from your liquor store establishments. And I would say right now, marijuana is more highly regulated than anything. It is from all the way through the system, really a very highly regulated system, which to us is a miracle because we're doing it without the federal government and we're doing it as the first in the nation to try it. And so that's kind of when the governor says that he's seeing some optimism in the short term, I don't think any of us imagined it was going to work out quite this well inside the license system without more hiccups. And so certainly now we're going to talk about the hiccups we've been seeing, but just the fact that wholesale this exists has been a big deal for us. So 4 areas that have gotten more complicated over time. Of course, we have to start with edibles. Very quickly on edibles, our marijuana working group, which is all the cabinet directors in the Hickenlooper's cabinet that deal with marijuana, have identified kind of 3 issues that they see as problems with edibles that have to find regulatory solutions. The first is the overdosing problem that comes with the delayed reaction. And so everybody's heard, everybody's read the Maureen Dowd story, everybody's seen the opening tragedies that happened with this, but you have 1 dose of marijuana, you wait about 20 minutes, you think you've gotten the first dud ever, you take another dose of marijuana, and then maybe you take a third, and then you decide marijuana just doesn't work for you, and so you start to drink alcohol, and suddenly you have a really bad night. And so for that, our regulatory solutions at the beginning, we were allowing for multiple doses to be in one product. So you could have a cookie, it could have 10 doses of marijuana, which we consider to be 10 milligrams of THC. That was, and bud tenders were even telling people to cut it up into 10 blocks, but the natural inclination to eat more than a tenth of a cookie was taking hold, and so now we either required you have it in a single product, 10 milligrams, or easily scored demarcated, so it's incredibly intuitive when you're having 1 dose of marijuana. We also did public education campaigns, as did the industry, and it does seem to be showing up, especially with Colorado residents. It's harder with tourists. It's really hard to get to them quick enough. But with Colorado residents, they do seem to be getting the message about overdosing. Tourists also overdose on a lot of things like alcohol too. And so we are still trying to find ways to get them at the airport, to get them early on to say you could have a really bad night if you don't follow the instructions. The second problem we saw with edibles was accidental ingestion. Animals, probably more important, babies, kids showing up in the hospital. We used to allow for edibles to leave the retail stores in child-proof resealable packaging, but that would just be that little exit bag people knows about. Well, you come home, you take it out of the exit package, it's no longer going to be resealable, it's no longer going to be childproof. Now it has to leave the manufacturer in childproof resealable packaging. It looks much more like medicinal packaging than it did before, opaque with a lot of warnings on it. Additionally, we started to make sure you have to actually stamp the product itself on the product with a little caution sign with a little exclamation point and the letters THC. You don't have to read English to know then that this is an adulterated product. It'll also help us. It's not that will stop the 2-year-old from eating it. It will help the parent who sees that the 2-year-old is eating something to know that what they're eating is more than just, oops, they got into the candy jar. They actually probably need to go to the hospital now. And so it's the same thing we do with prescription drugs or even over-the-counter drugs, and I think it will help us identify and solve issues more quickly. And finally, the third problem that we saw was, are we needlessly desensitizing kids? I call it the gummy bear problem. Do we really need to have gummy bears when doesn't that kind of harken back to candied cigarettes from the 1980s and 1990s? Not that we have to say you can't have gummies, but simply does it have to be in the shape of bears? And so we passed legislation to say, don't make it look like a person, don't make it look like an animal, and don't make it look like a fruit. And then please go closer to the Godiva chocolate line and further away from what you would see in the bulk aisle of the candy store for a kid's candy. Not going to say that those solve all the problems, but those certainly are regulatory answers to the problems that we've identified, and we hope to see that showing up in the data down the road, that we'll see fewer kids showing up in the hospital, fewer adults showing up in the hospital, and ultimately fewer tragedies down the line. The second problem that we are still dealing with is advertising. I think you'll see a little bit of push and take from industry. I think right now there's a little bit of a so we've tried to crosswalk everything from tobacco advertising onto marijuana advertising, and with some success. There's some things in tobacco that are there because of the master settlement agreement, and so it's not necessarily First Amendment legitimate to put it onto marijuana, and so we're trying to figure out how to crosswalk that. It's very complicated. It's a lot of First Amendment work. You have to get your attorney generals involved in order to figure out what works. And then there's also loopholes that we're starting to see. We're starting to see people, okay, my licensee can't advertise, so why don't I open up a shell LLC that isn't the licensee, that has the same brand, and we'll advertise through them. So now we have to go back to the legislation and say, no, you can't co-brand without, you can't co-brand with a separate LLC and simply run your marketing dollars through there. I mean, there's just going to be a lot of advertising is a tough one, and so it's one that we have to keep our eyes on. It gets incredibly intricate, and there are ways around it right now. And so again, a place we have to shore up. The third one is going to be public consumption. It's right now it's on the ballot in Denver. Separate cities and counties have done their own thing with pot clubs or pot events. We have not given a state answer on what public consumption should look like. And it's a hard debate because I think there are some legitimate points on one side that if you're going to come in as a tourist and you can't use it in your hotel room, are we pushing you towards edibles or pushing you towards breaking the law by smoking it in the street? If you don't own your house or own your home, where are you supposed to do it? And then on the other side, if we start allowing for if we start allowing for commercial consumption, are we going to start to normalize this and commercialize it in a way that we really truly will be attracting kids to the market, and you will start to see our youth data go up a lot. And so it is a place where there's a lot of give and take, and there's an ongoing debate about what role commercial consumption should have in Colorado, not to mention dual consumption of both alcohol and marijuana in similar places. I think it is not a question we've answered, and it's one that is going to take, again, a collaborative approach to really think through what are the best solutions for that. The last one I'll talk about is pesticides. Pesticides, like if I could take away one thing from my plate, it would be pesticides in a heartbeat. Pesticides are hard. People have been growing marijuana their own way for a long time, often using something called Eagle 20. Our initial research is Eagle 20 is not a great thing to use on marijuana plants, and we don't have the EPA to help us all that much on what is safe for use. And so we're starting it just like we start any other new crop, which is that it has to be broadly labeled for it. Since it is smoked, it has to have a tobacco exemption. Since it is eaten, it has to have an edible exemption. And since we don't know what are called tolerance rates, so that if somebody says, if the EPA says this is healthy, but only to a certain extent for different plants, we don't know what those are yet for marijuana. So right now they have to be what's called tolerance exempt, which means that you can put as much of it as you want on a specific crop and not have to worry about the health consequences of it. That's a fairly high line and it allows for very few pesticides, and I think has made the industry have to change the way that they're growing in a lot of ways. And so it's been a very contentious back and forth there, and pesticide regulation and including enforcement has been difficult along the way. I'll say that it has been one of probably the most contentious, at least for monetary purposes, the most contentious issues. There is some good news in there. There is a way now through what's called the 24C exception to get a local exemption for a pesticide if people should go through that process to say that these pesticides can now be used on marijuana. And also recently the California Department of Pesticide Residuals, I think it's called, is getting into the game of trying to figure out what's right. And they're very close to the EPA in terms of how many employees they have and the kind of science and rigor and toxicology reports they do. So I hope we can learn from a lot of the work that they're putting into it. It's a very big department. And some of the science that they put into it. So for long term, we'll have a better idea of what is safe and healthy to put on marijuana. My last big one is going to be the gray market. And I think you'll hear about this quite a bit. And I'm just going to check. Yep, fine. So there's this entire licensed market that I've told you about that I honestly believe is behaving much the way that people who voted for Amendment 64 believed that the licensed market would operate. Unfortunately, there's also a lot of ways to grow at home from both Amendment 20 and Amendment 64 that are interplayed in confusing ways. You can be a patient that can get an extended plant count up to 99 plants. You can be a caregiver that can grow for many patients. You can also grow your own 6 plants, and under current definition, you could maybe help others. You could create a co-op of allowing other people to grow their 6 recreational plants with you. And so what that means is there's just a whole bunch of ways to legally grow marijuana in the basement of your house. And it's both confusing for local law enforcement and really hard to wrap our arms around what exactly is going on. Here's why I say this matters for the licensed market. First, every time we try to add regulation to the licensed market, they tell us that we're just ultimately just giving unfair advantage to the unlicensed market. And there's some valid argument to that if you have a shadow market right next to a legitimate market, you are going to see regulatory costs push people into the other market. The second is data. Most of the time when we get back data, we don't know where that marijuana is coming from. And so if we have a whole bunch of hospitalization reports that say people are overdosing on edibles, there's an argument to say, well, maybe these are homegrown edibles that aren't 10 milligrams per product. Maybe these are 50 milligrams or not homogeneously spread through the product, or maybe this didn't go through the proper public health and public safety checks that our products go through. And so when there are 2 major markets in that way, it really is hard to delve into data the way we need to make sure that we know, is this a licensee problem or is this a home grow problem? And the third is perception. We most recently had 22,400 plants that were found being grown in the home market that were destined for other places and were part of an organized crime element trying to make money growing in this unlicensed market and selling it to other states, which is kind of a no-brainer because it's $4,000 a pound in a different state. And so that perception, it hits the licensee market just as much as it hits anything else, because you read a story about 10 Laotians in Colorado here for organized crime that have guns. You are going to attribute that to legalized marijuana, and a lot of people are not differentiating between whether or not that's coming out of the licensee or the unlicensed market. And so I do think that the licensees take a hit on their reputation based on what's going on in the unlicensed market. So in Colorado, and especially from the governor's office, there is very much an attempt to put common sense guardrails on top of the gray market. The general problem is that we've now created some of the loosest home grow laws in the nation, and that the criminal element has recognized that and moved here in order to abuse that system for out-of-state diversion. So we are on our path to try to figure out how best to make sure that the ways that home grows were allowed through medical marijuana and recreational marijuana are being adhered to for the purpose, which is, are you truly growing it for yourself as a patient? Are you truly growing it for somebody else as a patient? Are you truly growing this for recreational home use? None of which we have a problem with, but are you then also just trying to hide in plain daylight and actually using it for criminal enterprises? That's what we have to get to the bottom of. And so that's going to take some resources. That's going to take some careful defining of what the amendment language meant, and making sure that there's not creative ways of combining Amendment 20 and Amendment 64 to get unusually large grows in the basements of these rented out houses. And then finally, I'll just end with general data, a general data update. I think overall we're seeing what I would say, especially compared to the expectations of the governor's office, some generally good news, that we have not seen the sort of spikes in public health and public safety that actually fall out of statistical significance that have us raising any red flags at the moment. There are concerning trends that we look after, and I'll talk about those for a second. I'll start by saying first, we've not yet seen a change in consumption patterns for the number of consumers for adult use marijuana or youth use marijuana. Doesn't mean we won't into the future, and it doesn't mean that adults aren't using more. That's not showing up that's not something we're capturing with our data. But at least to say that we, at this point, have not seen consumer trends change all that much, and most thankfully haven't seen youth trends change all that much. We have seen a rise in hospitalization rates where people are coding in for marijuana. That means that at least something during the doctor's visit makes the doctor say marijuana. It doesn't mean that it's necessarily causal, but it's there. And that's of concern. Anecdotally, we think to the extent to which it's not just a better reporting now because it's not illegal, we think that it's probably an edibles problem and, again, an overdose problem for people showing up, and it's also poison control center calls. Those are dwarfed by alcohol still, so we try to remain calm. We are seeing an uptick in those things, but we're going to have to wait a few more years to figure out what's going on with that. And the second is DUID data and fatalities on the road. Again, this is a hard place for us because we redefined the law 2 years ago, and we then spent millions of dollars training officers in how to better spot marijuana impaired driving, but we are seeing an uptick. And so you would both expect to see an uptick when you've better defined a law and trained people more, but it's still a concern. And probably the most concerning is we're seeing more drivers involved in fatal accidents testing positive for marijuana. Again, our Department of Transportation says let's be cautious with that data because we might just be getting better at testing. We might get better at recognizing when to test and asking for that sort of toxicology report. But also there's reasons to say maybe that's not what's happening and maybe there is some sort of causal link there. And so it is going to have to be data that we watch more closely and say, is there a reason people are most often not just marijuana but engaging in polydrug use and then driving, and is there a reason they're doing it most often? Still, the good news in here is we're still at decades-long historic lows for fatalities on the roads, and so there is some good output of what's going on. It's just a trend we're going to have to look after. So all of that is to say that this is still very complicated and still very much worth your time and resources to come here and continue conversations. I think the best path forward, we meet once a month, and I call different states once a month, and we're kind of an open door here. We all know that the best solutions we're going to reach is when we have kind of these brainstorms together. So I thank you very much for your time.
So now I'm just going to run through sort of the first 3 years, kind of modeling after what Andrew presented, but the first 3 years from the city's standpoint, and then we'll open it up for questions. So first of all, I guess many of you are probably familiar that once Amendment 64 passed, cities and other jurisdictions had the opportunity to choose to opt in or opt out. In Denver, we decided to opt in. And I think and I wasn't actually in this position at that time, but I think primarily that decision was driven by the fact that 66% of our voters voted in favor of it in Denver. And so I think our elected officials felt like we had a mandate to opt in, to listen to the will of the voters and get this right. I know that other jurisdictions in Colorado opted in. I know some did it by their legislative body or their governing body, but some also put it to a vote before the people, before they decide to opt in. So then once we opted in, so you know, the state has authority over things of statewide concern. So the type of things that that Andrew was talking about, the edibles, tracking that data, packaging and all that type of stuff. Locals have authority over things such as time, place, and manner restrictions, sort of our regulatory type issues that we handle, and the number of facilities that we want to allow in Denver. So as our city council was moving forward with going ahead and adopting a retail marijuana code, our mayor went and spoke to city council and said he would like to see a couple of things on the local level tighten up our retail marijuana code. And the first was he wanted area restrictions. He wanted 1,000-foot area restrictions between stores and daycares, drug and rehab facilities, schools, and then that 1,000-foot area restriction between each of the stores. He also asked for public hearings so that when the stores are opening, that we had needs and desires public hearings. And actually, our public hearings started off a little differently than needs and desires, but now we have needs and desires hearings for our stores, just like you do for, similar to what we do for liquor. And the other thing our mayor asked for is that we would have a transition period of time so that we wouldn't just right away open the door and start accepting licenses on retail marijuana businesses, that we did a phased-in, a transition phase, so that only currently existing medical marijuana businesses who were in good standing could convert to retail marijuana. And that was for a period of time. I think that was 2 years. So that was one of the things. And so since then, we have continued to evolve, like Andrew said. I mean, it is, as we're getting all this work done and we're seeing stuff and we're tracking and we're monitoring and we're looking at the issues on our table and we're finding areas where we feel like we need to tweak the laws, where we could be doing something differently. And sometimes it arises because we didn't actually know what the true processes were the industry was engaged in. We didn't really maybe know the full extent of what a manufacturing facility or a manufacturing machine might look like. And because of that, we changed some of our initial set of rules. That one's sort of a good example. We initially had, and some of this will be talked about in more depth in some of the other presentations, but we initially had manufacturers of infused products in sort of the kitchen type, zoned in kitchen areas, food prep and sales. And zoning will tell you, at first they thought it was because people were chopping up marijuana and baking it in brownies. Well, then we learned, no, they were using these extraction machines. So then we had it zoned industrial. And then we learned that these processes are getting larger and larger, and the machines are getting larger and larger, and the amount of materials that they're using is just using a lot larger stuff with these flammable solvents. So we had them zone heavy industrial. So that's an example of how we've had to evolve and change. And I know, and understandably, the industry at times, gets frustrated with us and feels like we're changing the rules as we go along and that they're having a hard time keeping up. But I think just like Mr. Ogilvy's article said, we have to be, we can't put our initial set of rules in thinking we know everything and then start learning things and seeing how things are changing and evolving. We can't be frozen in our initial set of choices. We need to be reacting based on what the industry is doing, so that we are keeping them safe, our community safe, our citizens safe, and properly regulating this industry. And the other thing that really is overarching all of this, as you remember, is the federal government said, basically, that they would let these experiments go forward, this experiment with retail and legal marijuana, as long as cities and states had strict rules and robust enforcement. So that really is our marching orders, and that's what we're trying to do, and why it's so important that we work so closely with everybody, including the industry, to know what they're doing, to know what new innovations might be coming, so that we can anticipate their specific regulatory needs and put in the rules and regulations that we need to make them safe. So over this year, we've changed a few things. One thing, and this will be spoken about in more detail in another breakout session, was we put in a capping bill. When marijuana first started in Colorado and City Council first passed the Denver Retail Marijuana Code, they did not put any caps on the number of businesses. Our first year out of the gate, we were focused on, and as you know, there's so many issues in marijuana, we were focusing on some of the primary public safety issues, taking care of home hash oil extractions, limiting plants and non-licensed grows to 36 plants, and doing some other things. And as that year passed, we started realizing we were getting more and more and more marijuana businesses coming into our city. But right now, I think we have a little bit over 1,000 licenses operating out of 440 unique locations. So around last year at this time, we went to City Council. We told them we thought that it looks like we might be getting saturated, that we might have too many marijuana businesses in our city. And then City Council moved forward with adopting a capping bill. So setting a cap on the number of stores, and there's some complications in it, some variations in it that'll be explained later, I think by Rebecca. And so that the capping bill, and the plan is that the caps at some point we're above the caps now, but when we get below the caps, we would go into a lottery type system. So that was something that we worked on this year. Another thing we did this year was our omnibus licensing cleanup bill. You'll hear about that from excise and licenses, from Stacy Laux, going in and just cleaning up things like how do we measure proximity, do we put a time frame on which an application would expire, and a number of other things. Another thing you'll hear about is we adopted an odor ordinance. That was through our Department of Environmental Health and NDCC. Another group worked on that odor ordinance to require that certain businesses, including marijuana businesses have to have an odor mitigation plan. Another thing we worked on too, again, as these things were evolving, started realizing that the level of extractions that these businesses were doing probably required a different type of coding for the type of room that they could do that in. And so we went through a big process with the industry, with our fire department, with our building inspectors and mechanical inspectors, and we changed the rules around that extraction at a certain level has to be done in an explosion-proof room. So we've had a lot of growth this year, and it's caused a lot more work. It's caused our employees, it's caused work to figure out what we need. It's caused our employees now work on the back end on being sure that we're implementing this properly. But some things have stayed the same. Some things have stayed the same. I mean, our general issues that we're looking at every day, we have kind of an ongoing list about regulation, there's regulation, enforcement, education, youth prevention, public health, our neighborhoods, our communities, the economic impact, tourism. What is the issue with homelessness? We hear anecdotally some homeless people say they've come here because of marijuana. What is the truth around that? What is the data around that? Pot clubs, social consumption. So we have a whole host of other issues that are continuing to come to us, and we have to prioritize them. But most importantly is the team that we've put together and the collaborative model that we have for addressing all of these problems that we have. Andrew touched on the gray market. That's something that we had been looking at before and we're continuing to look at. We have put together a team that includes my team, the fire department, the police department, zoning, neighborhood inspection services, and a whole host of others. And we're meeting on this because, they have the impacts are far ranging. So somebody might call, and we have a hard time tracking them because they're not tracked at the state level. So we might get calls from neighborhood inspection services. Neighborhood inspection services might have a call about a house that's abandoned and their grass isn't being cut. And so we'll go into those houses and find a grow, and then work with DPD or fire to do what we need to do. But we're pulling all of those groups together, so we're tracking all that data. Actually, City Council gets a lot of calls about home grows, so we're just starting to build out a database of where are these, what are the problems, what are the issues. Commander Henning will talk about, we have had some homicides related to home invasions with people trying to steal marijuana at a home grow, and have had a couple of other really significant issues with the home grows. So our team is gathering the data, figuring out what the issues are, and we're brainstorming solutions. And one of the first ways we've done to brainstorm those solutions is looking at what you all have done. We've been doing research on all of the different ordinances across the states and across our jurisdiction on how are different groups and different jurisdictions putting their rules and regulations in place for home grows and what would be the most effective choice for Denver. And there's a microphone behind you.
Good morning. I want to thank you for your presentation, and I also want to thank you for the collaborative approach that you all have taken. It's really phenomenal, and it's exemplary of what communities should do, and I thank both of you all for that. The one issue, if we're going to really grow this industry, and I'm speaking from the industry side, is to have the ecosystem in place that supports the development of this. Innovation that may occur, DUI instances will come out of, I think, university research and out of that kind of thing. And if we're going to really grow it, we've got to solve the banking problem. I mean, that is really the number one issue that all of us are confronting, and it's a lost opportunity. If you think about the dollars that are flowing from this industry to get into a normalized bank, they could use that money to actually reinvest through the CIA process back into the communities on things that the community that really need that government can't do or can partner with. So I think that should be on the top of the agenda. And I'd like to see the city and state, and I would say this to all cities and states, perhaps start to use some of your leverage to say to some of the local banks, look, we have a lot of dollars that come through here, and we're going to make some decisions about where we put our dollars and who we bank with as a government. We want you to get in this business, and we want you to follow the rules and regulations, because that's another way of also identifying and pushing out the gray market, because they're going to pop up as being the ones that can't comply. And so that would be my request of you all, is that we move in the next year. And as other communities develop this, all of us join together and start to think about banking, because that is really how we're going to close the loop, how we're going to get rid of the gray market, and it's really an opportunity for the community to grow through reinvestment. Thank you.
Yeah, and I think the banking piece has been on the top of both mine and Andrew's agenda. But this year with the election, there was just kind of, there wasn't really the opportunity to start moving forward with stuff in DC. I know both my mayor and the governor and the chief of police and a number of people have been to DC trying to push that banking agenda, but we're really holding off until after the election passes and hope we can make some headway.
Just for some background for people who might not know why banking is a problem or trying to work it through, obviously this is still a federal felony. Money laundering or banking marijuana is technically money laundering. The FinCEN did put out guidance that said, if you're going to do it, here's the way to do it, but it was a lot of regulation, and then they ended it by saying, and that still doesn't mean it's legal to do it. And so it was a big, giant, blinking yellow light. Nobody knew what to do with it. We tried as many kind of aggressive approaches as we could to it. We started we created a financial institution model called the Cannabis Co-op. We got shut down by the Federal Reserve on that one. And then we chartered a credit union called the Fourth Corner Credit Union that was entirely a cannabis credit union. They're still in litigation, and I think there's something this month on that, but they initially also were turned down by the Federal Reserve. What we have found some luck in here is forgiveness rather than permission. So we have seen some community banks and credit unions enter into banking relationships with the industry, and they are filling out suspicious activity reports. So they are telling the federal government that they're doing this, and they're seeing no action from the federal government, which I think in general, if you're wondering how the federal government interaction goes, if we put them in a position where they don't have to say anything, we're okay. If we're putting them in a position where they have to give us permission, it's still a federal crime, and so we get a no whenever we ask for permission. And so that is the short term where we're seeing some, and we do meet with banking boards all over the place. That's part of my job, is just to go around and talk to banking boards about if they wanted to do this work. We'll never push somebody into a financial decision like that, but if they want to do this work, here's the metric system that exists. Here's the ways in which you can use what's currently in regulatory in regulation to make sure that you're abiding by the suspicious activity reports. So we've seen it go from an unbanked industry to an underbanked industry. I'm going to try my pun. It never works. Maybe you could say it's a half-banked industry. Yeah, that's the.
That's a good one.
I like that one. But it certainly is something that in order to get the sort of public safety, and by the way, even when they have banking relationships, they still often don't have credit card relationships. So the only way that we're truly going to get the public safety and the financial oversight over this industry that is required of highly regulated industries is with congressional action. And so it's something that both the governor and the mayor are pushing hard for.
Hello.
Yes, sir?
Well, thank you for that statement. My name is Alan, and I represent California counties, and we're very interested in the banking issue as well and looking at it, and thank you for that. But I do want to ask a specific question, and I know that we'll be getting into some elements of this later in the conference, but maybe generally speaking, since this is a 3-year overview, can you talk a little bit about, you mentioned earlier, Andrew, that that you've developed this great regulatory system without any help from the federal government, and so clearly there's a cost associated with that from the state. The city of Denver has their own time, place, manner restrictions that also have a cost. Forgetting aside the public safety concerns, each of you have revenue raising ability. And so I want to learn a little bit more just generally in the 3 years you've looked back, have the costs of developing that program and operating it. I mean, you even talked about training law enforcement on other specific things. There's costs there, but the cost of developing the regulatory framework and at the local level, have they matched the revenues that you've been able to receive via taxation or permit costs? And what lessons have you learned about setting those rates and permit fees, both at the state level and in individual jurisdictions? And the last point is, how have you seen sort of differences among jurisdictions within the state, levy certain rates or have certain permitting fees, and not being enough, and how have they collaborated with the state in that regard?
That's a lot. Okay. Important. And there's one good government point that I would bring up here is, so the short answer is that fees have generally been able to pay for the Marijuana Enforcement Division and getting along with just the kind of nuts and bolts of how regulation should work directly to the licensees. It is important to note that you shouldn't only rely on fees. There should be a drawdown fund from taxes, because if you rely on fees that, everybody knows those are not very constant sources of revenue. And so we've gotten in trouble before relying only on fees and not having an ability to draw down from general or from tax cash fund, that then all of a sudden you have to fire people. And that's not a good way of running an enforcement division. So my first suggestion would be, yes, I think you can pay for most of the licensee regulations through fees. However, I would set aside money from taxes in order to, if you should need some money along the way. The second comment is for the broader kind of parts of regulation, which I include public education campaigns, training of police officers, pesticide work. I mean, there's a lot of stuff that falls outside of the licensees that go to different departments. Generally, we peg that number around $20 to $30 million a year, and it's the first thing we pay for out of our tax cash fund, other than $40 million to schools, because that's written in our Constitution. But it's our highest priority of what has to be paid for. That's still just about a fifth of what comes in that way. And so it does, marijuana with proper taxation and fees does pay its own way, and still have money left over for prevention and substance abuse. The one thing I will say, though, is while it does pay its own way, I think if we had to do it over again, we would try to convince the General Assembly to loan some money from the general fund early on for us to get these things started, to get public education campaigns up and running, to do DUID training. We would loan first and repay it with marijuana tax cash fund. We waited for the tax revenue to come in to pay for that stuff. And so I think we could have been even more ready on day one had we taken those loans out.
And at the city, our marijuana-related revenue is about 2.5% of the overall revenue to the city. It looks like this year we're on track to bring in about $30 million in tax revenue related to marijuana. About a third or so, or let's say most of that, is a regular sales tax on retail marijuana, regular sales tax on medical marijuana, and then we also have licensing fees and application fees. We have a special 3.5% special sales tax on retail marijuana, and that amount came out to be about $9 million. So we've got that whole $30 million pot and that special sales tax of $9 million. It all goes into our general fund, but the 3.5% sales tax is soft dedicated to pay for such things as regulation, education, enforcement, and then sort of other city needs. So that $9 million right there has pretty much gone to pay that. We have a really robust website that shows exactly multiple pie charts of where our money's coming from, where it's going, and how we took that 3.5% and apportioned it not just by the priority area, being regulation, enforcement, education, and other city services, but also by the specific agencies. And there will be a much more detailed breakout session on some of this information.
Good morning. Good morning, Andrew. Good to see you again.
Good morning.
Eric Bergman with Colorado Counties Incorporated. One of the biggest issues amongst county governments around the state has been the proliferation of the black and gray market, and especially the home grow situation. And we've had conversations on this with your office. Denver was one of the first to adopt a plant cap locally. And I know this may come up in the building and home zoning issue later today or tomorrow, I can't remember, but wanted to kind of hear your experiences actually with being one of the first ones to have a plant cap. There has been a challenge now down in Colorado Springs, as I understand it, but we've got a growing number of counties that see this as the number one public safety issue, is just the fact that homes are not really designed to be growing large amounts of these plants. And the zoning powers that are granted to counties and cities are pretty solid, and we feel like we're on pretty good ground, but I think there is a challenge pending out there, and wanted to kind of hear your reflections on that approach.
Yeah. Yes, absolutely. Well, right away, one of the first things we did is we passed that in homes, no matter how many, no matter if you had a red card and your red card said you could grow 1,000 plants, or if you had 20 roommates living with you and you each could grow 6 plants, we said no matter what, in a dwelling unit in Denver, you're limited to 12 plants per dwelling unit. So that was great. You know, keep it out of the houses. Then what we started seeing is people wanted to grow more, so they were going and getting industrial warehouses elsewhere and growing even more. So, and they were either growing it under Amendment 20 for medical marijuana, and maybe they had a plant count waiver for 100 plants, or they were also taking advantage of Amendment 64, which said you could grow for yourself and for others. So we had limited it to 12 in the houses, and we started seeing this unintended consequences of these big, we're talking about unintended consequences and always having to be aware of that, started seeing these big warehouses that people were getting together and growing marijuana in. And it happened pretty quickly. By mid 2014, our officers were seeing these unlicensed warehouse grows of up to 2,000 plants. And, you know, we saw real significant safety issues, from overloaded electrical to blocked egress to, you know, just all kinds of sort of the building safety side, but also when, you know, the suspicion that when somebody's growing that many plants, that there's a chance it could be being diverted to the legal black market. So we went to City Council on that one as well and said, you know, we've got the 12 plant count limit in homes. We want to limit non-licensed marijuana grows to 36 plants per zone lot. And we really did think we were going to get a lot of pushback from, say, the medical community. People who say, you know, well, I need my 1,000 plants and I have to grow 1,000 plants. And we said, but in Denver, we have a dense urban environment, and it is not safe for us to have warehouses throughout the city with a ton of marijuana. But you could still grow your 100 plants. You would just have to get one zone lot, another zone lot, and another zone lot. Because we think that by keeping them separated instead of all crammed into one area, we reduce the safety risks. And then we had our officers, and then we had a list of where we had the complaints of these buildings, and we had our officers go through. I think we first started by sending letters to them and then starting to do enforcement actions, going by these businesses and making sure that they tear down their plants down to 36.
Did you have a separation between grows also?
What do you mean by separation between grows?
You have dispensaries, you have 1,000 feet
Oh.
between dispensaries. Would the grows be separate also?
We did not have that initially. Now we do have we recently added that grows, they have to be in a certain zone district, but now we've also said even if you're in that zone district, you still have to be 1,000-foot setback from residential. So, yes, sir.
My name is David Labradin with Nexus Greenhouse Systems. What is your assessment of what's going on in Pueblo for the effort to roll back the industry in Pueblo? And if it does pass, what impact do you think that will have on the state?
Well, this is a difficult one. I don't weigh in on where locals should go with their preferences. So what you're not hearing from me in any way is an endorsement of either side of this. But at least the issues that I'm seeing in Pueblo are, again, I hate to harp on this, much more about the gray market than I've seen about the licensee market. Pueblo is one of the places, Denver has a lot of resources to police home grows and really make sure that those are being used for the proper places. Once you get more rural, the home grow situation really does get both more out of control because there's more space there, but also harder to enforce because there's fewer resources for enforcement. And so, I think regardless of the outcome of Pueblo's election, and for those that don't know, the county of Pueblo has allowed for commercial recreational marijuana, and now there is a vote to disallow that. And I believe that Commissioner Pace, who's from Pueblo, will be in the next panel. I'm probably able more to talk about it and with a point of view of what should happen for it. But from my point of view, and kind of regardless of what happens, the next day we should be in Pueblo talking about this home grow problem, because I don't think it's one that Puebloans, that will get me in trouble. How do you say that? Oh, shoot.
I don't know.
Okay.
Ask Commissioner Pace.
People from Pueblo don't quite, haven't been educated on that, yes, you do have a commercial market, but probably the bigger public safety risk in Pueblo is the home grow market.
Good morning.
Good morning.
My name is Tom Smith. I'm the managing director for CanaScore. And I want to readdress this thing about banking. One of the issues that we have been addressing quite a bit in talking to banks and third-party coordinators, people who are trying to handle the compliance for banks, is some real issues dealing with FinCEN. And one of the enforcement people that was head of enforcement for FinCEN, who's retired, made a comment that the biggest issue with the Cole Memo, or the Cole Memo itself, was not applied specifically to banks. It was applied to the cannabis operations. We've found that a lot of the cannabis operations are not aware that they're really responsible to show the banks that they can be a non-money laundering operation. They meet the BSA, and they go ahead and they know their customer or made themselves known. What is the city and state doing to help educate these cannabis operations to help in this banking issue?
So I disagree slightly with the way it was worded. It still technically is money laundering, even if you meet all of the FinCEN guidelines. It just falls out of the zone of what they are going to prioritize as enforcement. Much like the way the Cole Memo is written, still everything that we're doing is a federal crime. It just falls out of where their enforcement priorities are. And so that's, banks are generally risk-adverse people, and so when they hear that this is does still violate the BSA, the Anti-Money Laundering Act, and the Banking Secrecy Act. It's just that it's not going to be something that's enforced. That's not the best message for banks, and that still does scare off basically the top tier banks. I just don't think that there's anything within current regulatory guidelines that would get the top tier banks involved. And then we do spend a lot of time, not so much with the licensees, but with the community banks and the credit unions themselves, saying, here's what you can demand of the licensees as they enter into your system that will help you fill out the suspicious activity reports, and have them be the educators of people that they're bringing on board. And so, not all these people want to be public, but I work a lot with Partners Credit Union, who has come out publicly to say that they are banking marijuana, and they do. They have to educate every licensee that they bring on about what, first of all, they have to give over as a licensee, and how they have to be regulatorily compliant in order to continue to be banked by them. Unfortunately, that means kind of the worst actors who don't want to meet those standards are the exact people who will be unbanked and have less regulatory oversight, but that's just the output of kind of this crazy world we're in right now.
Okay, thank you. One follow-up on that, and that is that, I understand that it is still money laundering, but I have not seen any concerted effort to really try and tie it together, because a lot of these community banks and a lot of these credit unions, they're still on the hook to a certain extent. And I know there's one bank in particular that I'm aware of that actually went through federal, and it was a bank, not a credit union, that went through various examiners. And they, because of the type of way that they were working with their cannabis customers, were able to succeed. Is there a way of maybe educating and coordinating from the city and state inspectors to kind of help this along? Because it is possible, even though they say it's a federal crime, what we're finding the regulators are doing is if they're showing a good program, they tend to be more understanding of what's going on.
And that is being shared in conferences. I mean, we spend a lot of our time going around to community banks and to credit unions and saying, here's what we're seeing that is getting basically no action from the federal government. Our banking commissioner, Chris Mickelbust, myself, often spend a lot of time saying, here's what is happening and seems to be getting no action.
Great. Thank you so much.
And I would just add, there are private consultants that are offering that type of service as well. Thank you.